Vaginal yeast infection is a fungal infection that causes irritation, discharge, and severe itching of the vagina and vulva, the tissue at the vaginal opening. Also known as vaginal candidiasis, a vaginal yeast infection affects up to 3 out of 4 women at some point in their lives. Many women experience at least 2 episodes. A vaginal yeast infection is not considered a sexually transmitted infection. However, there is an increased risk of vaginal yeast infection at the time of the first regular sexual activity. There is also some evidence that infections may be linked to mouth-to-genital contact, oral to genital sex. Medications can effectively treat vaginal yeast infections. If you have recurring yeast infections, 4 or more in a year, you may need a longer treatment cycle and maintenance schedule. Symptoms of a yeast infection can range from mild to moderate and include itching and irritation in the vagina and vulva, a burning sensation, especially during intercourse or urination, redness and swelling of the vulva, vaginal aches and pains, vaginal rash, thick, white, odorless vaginal discharge that looks like cottage cheese, watery vaginal discharge. You might have a complicated yeast infection if you have severe signs and symptoms, such as extensive redness, swelling and itching that leads to tears, cracks or sores. You have 4 or more yeast infections in a year. Your infection is caused by a less typical type of fungus. You're pregnant. You have uncontrolled diabetes. Your immune system is weakened due to certain medications or medical conditions such as HIV infection. The fungus Candida albicans is responsible for most vaginal yeast infections. Your vagina naturally contains a balanced mix of yeast, including Candida and bacteria. Certain bacteria, lactobacilli, prevent the overgrowth of yeast. But this balance can be disturbed. An overgrowth of Candida, or the penetration of the fungus into the deeper cell layers of the vagina, causes the signs and symptoms of a yeast infection. Factors that increase your risk of developing a yeast infection include use of antibiotics. Yeast infections are common in women who take antibiotics. Broad-spectrum antibiotics, which kill a range of bacteria, also kill healthy bacteria in your vagina, leading to an overgrowth of yeast. 2. Elevated estrogen levels. Yeast infections are more common in women with higher estrogen levels, such as pregnant women or women taking high-dose estrogen birth control pills or estrogen hormone therapy. 3. Uncontrolled diabetes. Women with poorly controlled blood sugar are at higher risk of yeast infections than women with well-controlled blood sugar. 4. Impaired immune system. Women with compromised immunity, such as from corticosteroid therapy or HIV infection, are more likely to get yeast infections. To reduce the risk of vaginal yeast infection, wear cotton crotch underwear that is not too tight. Avoid tight-fitting pantyhose, douches which remove some of the normal bacteria in the vagina that protect you from infection. Avoid fragrant feminine products, including bubble bath, pads and tampons. Avoid hot tubs and very hot baths, unnecessary use of antibiotics for colds or other viral infections, staying in wet clothing such as swimsuits and workout clothes for a long time. Remedy 1 for yeast infection include 10 heads garlic, that is 10 of a whole garlic as seen in the picture, 4 cups of water, and 2 tablespoons salt. Preparation. Peel your garlic and add the raw cloves to a mason jar so they are 1 inch from the top. Prepare a salt solution by dissolving salt in water. Pour salt solution into the mason jar until the garlic cloves are covered. Put the lid on the jar and store at room temperature in a dark place like your closet or cupboard. Open the jar once a day to release carbon dioxide. Fermentation fans call this burping. Continue this process for 3 to 4 weeks until fermentation bubbles no longer form. Move the jar to your fridge once fermentation has completed. Fermented garlic gets some more delicious as it ages. And finally, after fermentation, eat 2 cloves of the fermented garlic per day until you feel relieved. No matter the infections, these remedy will get rid of it.